This was a phase 1/2 dose escalation study designed really primarily to demonstrate safety and tolerability of the novel HIF-2 alpha agent, and also to look at efficacy of this drug in our patients with advanced clear cell renal cell carcinoma. This was an open label phase 1/2 dose escalation study. So it was all comers, any cancer type rather, could go into the dose escalation phase. And once we hit the recommended phase 2 dose, we expanded out into a clear cell renal cell population to test for efficacy and tolerability in a larger population. So primarily, the results of this study were updated results of the phase 1 group. So we looked at the safety, and we did not see any new safety signals in the additional follow-up time period. The two most common side effects that we saw with this were low oxygen level or hypoxia and low hemoglobin level or anemia. Both of those are expected toxicities based on how this drug works, so something we call on-target toxicity. They are both very easily managed by using either home oxygen for patients to take to make sure that their oxygenation stayed at an appropriate level, or to give them airnesp to generate a signal to their bone marrow to make more red cells, which resolve the anemia. The phase 2 portion, as we looked at larger populations of patients, did demonstrate good efficacy with pretty incredible durability for these patients. I personally have had a chance to have a couple of patients on this drug, a number of them for 3 years, and even one patient over 4 years at this point. So it's a really good option for our patients. I think it gives a lot of hope for our patients with kidney cancer. In a world where we are moving up the treatment so that patients are receiving both checkpoint inhibitors and tyrosine kinase inhibitors in the first line setting, if you use both of those agents and then you progress on that, you really don't have a backup plan. So this drug really does produce a great backup plan. And in fact, there are other results presented in the same session looking at it in the first line setting in combination with the tyrosine kinase inhibitor, where it looks quite good as well. So I think that this particular drug is a brand new novel area of opportunity for improvement in treatment of our kidney cancer patients. Really great things going on, and of course the most important thing is we're finding better options for our patients to help them treat them with drugs that are more effective and better tolerated, giving them a better quality of life with more quantity.